This article appeared about 10 days after my testimony, and I thought Cal was the only child in the United States with Kernicterus, because it really is a problem of developing countries. And the physicians who diagnosed Cal at University of Washington thought he was the only case of Kernicterus. And the day this came out, I got phone calls all day from mothers who said they had a child just like Cal, about the same age, no bilirubin test. And so we moms put our heads and hearts together. We decided to meet each other. So in 10 days after this article, we all flew to Chicago, where the American Academy of Pediatrics was showing a video of Cal to their members as a classic textbook case of Kernicterus and how this was apparently reappearing in the United States. So we moms got together, 8 of us crammed into 2 hotel rooms. We went to Sam's Club, bought our groceries. I think we bought about a case of Chardonnay, and we created PIC. So on the back of a napkin, in 36 hours, 8 moms created a nonprofit. We recruited the best doctors at the AAP to be our advisors. I had known Marty by then, so I recruited Marty to advise us. And what we did, and actually we didn't know what we were doing. I think there was a benefit of not understanding the healthcare system because we did not see barriers. We only saw opportunities. And so the moms we got together, one of our moms, one of the PIC dads was a website designer, so he created a website. And we hosted a meeting with the University of Pennsylvania and a pediatrician, and we brought in the Joint Commission, and we brought, then it was called HICFA, and NIH and HRSA. And I was asked last night, how in the world did we get these healthcare agencies to come to the table? And I had called the Joint Commission, Dennis O'Leary, who actually was sitting behind us on that panel when Leapfrog and I were testifying. And in my testimony, I criticized the Joint Commission and their lack of response to my letter when I wrote about Cal and Pat. So I called the Joint Commission and asked them if they would come to this PIC meeting. They said they would come, but if they were going to come, then HICFA had to come. So I said, well, who do I call at HICFA? So they gave me the number and the name, so I called HICFA. Jeff Kong, and Jeff Kong said, well, if Joint Commission's going to be there, we'll be there, but if we're going to be there, CDC has to be there. And I said, who do I call? So they said, well, Jose Cordero. So they gave me his name and his phone number, and I called Jose, and Jose said, well, if we'll be there, but if we're going to be there, NIH has to be there. So I said, great, who at NIH? Dwayne Alexander. So this went on like this. We had 27 organizations around one table, and we moms assumed that they all knew each other, that they worked together in the healthcare system, and we learned that this was the first time they were ever meeting each other around the table. So the moms presented the story. Children were suffering brain damage from jaundice because they weren't getting tested. Visual assessment had kind of taken over in the early 90s. It was a kinder, gentler approach that was somewhat implemented by the American Academy of Pediatrics and encouraged to test less because they thought babies were being over-tested. And so we presented the problem, and the solution was test all babies, a systematic, an implementation of a system-wide test all babies at the same time of PKU. We did the financial numbers, 36 cents if it's done with a PKU, maybe up to $10 if it's done with high technology now. We shared the cost of not doing the test, and that was a cost that's not the cost the hospital bears, as Susan from Premier was talking about, the cost of not doing certain things. But there's a cost that goes beyond the hospital walls. That's the cost that you as employers bear. Medicaid bears. Our children, one child cause is a multi-million-dollar cost. And so we presented that, and then we gave a to-do list to all of the agencies, and we didn't know it was unusual to give the Joint Commission a to-do list. But we did, and we gave them a list and asked them to issue a sentinel event alert, and there was pushback. Susan, we don't do that based on patient input, and we said, why not? And then we gave a to-do list to the CDC. We wanted a public health alert. We wanted monies to go to more research why this is reemerging. And the NQF. We wanted Kernicterus to be a never event. And we gave them 2 months, which, in healthcare, they said we don't move that fast. So as moms, we had done our research, and we shared with the healthcare industry that children were being strangled by mini blinds and by hoodies. And we showed other dangerous products where the manufacturers voluntarily changed production of those products in 2 months. So we said, if they can do it, why can't you? Are children less important in the healthcare than they are in the product industry? And in 2 months, lo and behold, the Joint Commission issued their first Sentinel event alert, requested by patients, and they invited PIC and others to help write that. CDC, also at 2 months, they didn't want to be outdone by the Joint Commission. They issued a public health alert on Kernicterus and case studies. And later on down the road, the NQF came out with Kernicterus as a never event. And I must say, as an aside, just this past year, the NQF retired that as a never event. And it is, I called NQF about this, and it was just a few days before public comment was to close, and it has been retired. And, but we'll get it back on there, or we'll go above that. But I think it's a tragedy to see something that was out front and center, making a difference, and now is slowly disappearing again. So somehow in healthcare, we have to keep these standards, we have to keep these never events front and center. And it might take the patient population to keep that going, and employers and purchasers. But it was a disappointment, and well, now that I'm on the Secretary's Infant Mortality Committee, I plan to put this on the table. The nursing profession, they stepped up. They were remarkable. They were the first ones to publicly come out with a position statement and endorse a universal bilirubin test. This is the brochure of Premier, if you're still here, thank you very much, and VHA and Marty, where I met John Nance, and I first presented on my family story and the call for change. And I'm going to show you a short video here of a beautiful example of partnership, how patients can set the agenda, bring in partners, and drive change. Maybe. Well, maybe not. Well, I want to share with you that, let's see if it's in here somewhere. Nope. I want to share that while PIC was out campaigning, we were speaking at every event we could, calling for partnership, and the Hospital Corporation of America stepped up. Actually, a doctor and I presented. It was an audience of about 2,000 people. This is in Miami, just enormous. HCA has 124 hospitals. They deliver 225,000 babies a year. And I presented along with a physician, and they implemented a universal bilirubin test in all of their hospitals. And what was rewarding about that is they stepped up and they did this before anybody else. They weren't made to do this. There were no regulations that made them do this. It was leadership. And Lucian talked about leadership. Leadership is a choice. And their leadership stepped up and said, we are choosing to do this no matter what. And one physician even wrote to me, and he said, I'm the guy who stood up at HCA Congress and promised you we change our hospital rules within 1 week. This CEO implemented a universal bilirubin test in 1 week. So again, leadership is a choice, change is a choice, implementing standards is a choice. So purchasers demand of your hospitals that they have a rapid way of implementing change. And when they say it takes, they can't for a couple years, that's an excuse.